Good morning. We are at the Medina County Free Clinic, and I would like to introduce Dr. Kim Bowen, who is the medical director and founder of the Free Clinic, and we'll hear a lot about, how his vision sort of flowered in the county, and Nancy Peacock, who is the executive director and has been with the clinic for a couple of years. And so Nancy will also tell us a little bit about her role. And so to begin with, I just have a quick question of Dr. Bowen. So what was your vision? What made you want to do change from a corporate ED physician to managing and developing a free clinic, both elsewhere and here in Medina?
I came out of residency in 1990 and started working as an ER physician. And at that time, I worked down at Charity Hospital back in the day of Huron Road and Hillcrest and Parma. Worked at several different hospitals. And one of the things that impressed me was that there was a good segment of patients that would show up with heart attacks or stroke or cancer that we'd find. And I found out that they couldn't afford their medicines and they didn't have insurance. And because of that, they didn't have any care to make sure that they don't get the heart attack and stroke and whatever. So what I did in Parma was we started a free clinic in Parma, and I got a couple of doctors that wanted to volunteer their time, nurses that wanted to volunteer their time, and we went ahead and opened that up at over at the office buildings in Parma, and we saw patients, once a week or twice a week, and then when I came down here, I came down to Medina in 93, 94, but I started working full time here in 98 and found out we had the same problem where there's patients that were not getting care to prevent them from getting diseases. And we found out that we needed to try to do the same thing down here. So the difficulty with here was that there was Salvation Army approached us, and they were wanted to volunteer a space for us. But at that time, all they had was a storage area and a closet, and we had a construction company that's local. They didn't want their names known, but they volunteered all the manpower, all the equipment, all the materials we needed to make 2 patient rooms and an administrative room. And that's all we needed. So once we got that done, we opened up in January of 2004. So when we opened up in January 2004, we had a host of doctors that would volunteer, including myself, and nurses that would volunteer. Back in those days, before Obamacare, we would see somewhere between 500 to 600 patients a year is what we'd see. And we took people that didn't have insurance. We did, and even occasionally we took in walk-ins occasionally that would come in and we'd take care of them. But that's how we started.
And I understand that the Cleveland Clinic has been really supportive of the move and and the growth within the free clinic. When did we move into this area that we're going to tour after our conversation?
We moved into here, I think, what was it?
2012.
2012, was it? I'd have to go back through the books and look.
Okay.
And the clinic was that was before with the Cleveland Clinic had just joined Medina Hospital. And they were very generous we still pay rent, but it's minimal. And they offered the whole office experience. That was one of my pet peeves about this situation was when people hear about free clinics, they think of, the basement of Metro Hospital and people that are very poor and indigent and maybe using drugs and being seen by either a medical resident or a student, medical student. And I emphasize that the people here get seen at a regular doctor's office by doctors that have had at least 10 years experience being physicians, and they are high quality doctors that are very caring. Same thing with our nurses.
And how would you describe the current patient that you either see or needs to know more about this?
Well, it's people that don't have insurance.
Mm-hmm.
We provide the medical care to take care of them and diagnose things. But we also, in conjunction with the Cleveland Clinic, we go by their HCAP guidelines. And by doing that, our patients will not get billed by the Cleveland Clinic for lab tests or radiology tests, anything like that.
But I understand most or many of your patients are actually working families or families who have recently lost a position or maybe are underinsured. Is that correct?
That's true. That's very, very true. We have patients that occasionally we have patients that have high deductible, but for the majority, we have patients that just are not insured, and it's during a hard time in their life.
Mm-hmm.
I cannot emphasize enough the fact that people that we see are just like your next door neighbors.
Mm-hmm.
And I mentioned to you before about the case of one of the cases I remember from Parma was a psychologist who she was working at several businesses that were down Brook Park Road in their HR departments. And she lost her job and she had to wait tables at a restaurant in order to cover things. So we took care of her medical needs for about a year and a half, 2 years. And she ended up getting a job out in Berkeley, California, at University of California, teaching psychology. And I swear to you, every year she would send us $500 because we helped her over a certain part of her life. That was a difficult time.
That's amazing.
And it's stories like that that just make you even more passionate about this program.
Absolutely. And maybe we could move to Nancy. So Nancy, you're the executive director. What passion brought you to the free clinic?
Well, my entire career was basically in journalism, and I worked at the Beacon Journal and the Gazette and freelance for a bunch of Cleveland publications. And so journalists are always for the underdog. So that's in your genes, or you wouldn't be a journalist. And so what happened was they were looking for an executive director, and the treasurer called me and just chatted with me on the phone. And then the next day they said, "Would the board would like to meet you." And so I came in and they showed me around. And this is the kind of thing that makes me want to work forever, because it's just a great cause. And what I can bring to it is the non-medical side, which is letting people know through the media and through all of my connections how to get more patients, how to get more patients. So the last 8 years, that's been my entire job, is to find the people that we need to find. And it's not easy, because people in generational poverty don't trust the medical system. They've ended up in collections too often. They're afraid of it. So what we have to do is really win them over, and not only win them over initially, but then we have to win them over after they become patients, because another aspect is they live from one medical crisis to the next. So we won't see them for a while. And it's when one of our nurses calls, "No, I'm fine," because they don't understand that it's a continuum of care. So for all these reasons, I have just fallen in love with this mission and the people who work here and the whole concept. And it's a great job.
That is so nice to hear. So part of it sounds like part of it might be just patient education about managing their health on a long-term basis. Is that correct?
That is huge. That is absolutely huge. And I hear that over and over from the nurses, from the doctors. It's just, when you're in the medical profession, it's hard to imagine that people would turn down free health care, but that's not what they're turning down. They're overcoming their fear. And so that's a lot of what we try to do, is see that, we aren't some medical establishment. We're people, we're friends, we're neighbors. And then they're more trusting.
One of the unique things about this program is that the nurses and the doctors can truly behave the way they were taught in medical school and nursing school. So it's not unusual for one of our nurses or doctors to spend a half hour to an hour with a patient. You can't do that in private practice anymore. You have to sit on the computer and make sure you're charging and all that kind of stuff. Whereas the doctors and nurses here love the fact that you're going back to your roots when you were back in medical school and also in nursing school, where it was all just about the patient and trying to educate them, try to help them. That's all it's about.
And so you've mentioned the nurses and the doctors a lot. Can you talk a little bit about the caliber of nurses and doctors that you have, and maybe the specialties that you can provide?
Yeah, we have only one specialty that we provide here, and that's a GYN female clinics that we have. We usually have one or two of them a month with Dr. Foote and Dr. Funk is who we have. The quality of the doctors and the nurses, they are exceptional. They all have years of experience in healthcare. They all are very personable people, obviously, very caring, but they're also very, very sharp. I could tell you from a doctor point of view, in all my years, in all 31 years of doing this, there were two doctors that wanted to work at our clinic, and I had to tell them no, that they were not appropriate. And the one was because of malpractice, the other one was because of sex encounters. I mean, there's the issues, and just didn't want to deal with that. One of the things that happened with us that makes us a little bit different than some of the other free clinics is, over the years, we've had to adapt to change. And I got to tell you, the most powerful thing about the clinic is our board and the board's ability to adjust to change. I recognize back when I was at Parma, we didn't have any paid positions at all. No paid positions. Everything was volunteer. And if you were to go around and talk to some of the other free clinics in Northern Ohio, you'll find out that the ones that don't have any paid positions don't have consistency in their clinic. With us, we have 3 paid positions. We have our executive director that's full-time paid. We have half-time nursing coordinator and half-time administrative assistant. So we don't pay a lot of money out, but we do run out a lot of volunteers. And because of the paid positions, we're a better clinic, I'll be honest with you, than the other ones that don't have that.
I would think so. I mean, I would think that you would have dedicated staff and their ability to be a big part of how this organization runs. So Nancy, are you sort of involved in the scheduling, or how does the scheduling of both your volunteer providers and your patients work?
Well, that is considered part of the medical side.
Okay.
So our clinic coordinator is responsible for that, and she is masterful at finding the patients and the doctors and making that connection and staying abreast of all that. So she's really incredible. The one thing that I was going to add too is that, speaking to Dr. Bowen's insistence that, our board is very flexible. A couple years ago, one of our board members said that her husband, who was a teacher in the Buckeye, was complaining that his students could not afford the cost of physicals. So we went to the board and we said, "What do you think? We don't take care of students, but in this case, we would make an exception." The board said, "Absolutely." So we've been seeing now any student in Medina County, regardless of income level, is welcome to come here and get a free physical.
Wow.
And so we have really been able to reach out, and we do that for a couple reasons, just because it's a great idea, but also because we want the young people to know that we're here, and we want them to know what's available in the community. They could end up needing our services at some point, or they could become a supporter at some point.
One of the things about physicals is 2 things. One, they can be expensive. They can be like $85 for a physical. You got 3 kids that are going into sports, that's quite a chunk of change. The other issue is when you get a physical here, you're getting a physical done by Dr. Tluziak or Dr. Case or Dr. Wygan, Dr. Zeiger. You're getting taken care of by a boarded doctor that's had years of experience. There are some people that advertise physicals that are chiropractors. They're not even medical doctors. And I got to tell you, the important thing, it doesn't happen very often, but every now and then I'll get a physical where I'll hear a heart murmur, or I'll hear something that is not right, and to get the patient's family to follow up on that. And that's the nice thing about having the kind of doctors we have.
Sure. So you see a patient who comes in, and maybe it's a new patient, and maybe they haven't had care for quite a while, but they need some meds, or they need an x-ray, or they need some sort of cardiology testing. How does that work? Does the clinic provide that, or how do you manage that?
The clinic, what we do we coordinate patients to apply for assistance at the Cleveland Clinic and the HCAP category. And what that is to anybody that's 250% above poverty level, and for that year, can get all the tests done, all the labs done, whatever it may be. Or if we need a specialist, say we need a cardiologist or we need a pulmonologist, we can actually get them referred to someone and connect them to somebody. Medication-wise, years ago at Parma, I recognized medication was an issue. And back then, that's back when Mr. Glossman, Mark Glossman, had just 2 or 3 pharmacy stores that he had. And I approached him, and he gave me these $5 coupons. So if I was a doctor at Parma and I was writing you a very expensive medication, then I'd give you 10 of these coupons to take with you and get that knocked off the price at Mark's. And he never complained about it, Mr. Glossman. He was just remarkable. So the same thing came up here. I mean, people are having problems with their common medications because they may be on 3 or 4 medications. All of them may be less than $100 a month. But when you add up $150 worth of meds, that's a lot of money. So we made a deal with Mark's, and what they do is they charge us what it cost them to develop to give the patient the medicine, and then every month we pay them for all our patients. And it's a great win because it helps the patients, and it's great PR for Mark's. I mean, they're helping the community, and it helps us.
That's remarkable.
You know, so it's a great win for us as far as that's concerned.
So I understand that you are one of the premier free clinics in Ohio. Can you kind of talk about, the award or the how you've been acknowledged in the state?
Well, it's an organization that has 51 free clinics in the state, and it's called the Charitable Healthcare Network. And it's a very well-run organization. They not only create regional meetings where we can meet together, but we also have an annual symposium, which is coming up in April. So we're more connected with each other than sitting in these little silos. And we can exchange information, talk about what works, what we need help with. And they're very responsible about getting back to us. And I serve on the nominating committee for the board of the state as well. So they have a way of drawing you in and making sure that they're connected. And it's been a real win-win for clinics our size, clinics that are bigger than us, and then these little mom and pop things that are 2 people big. So it's really enhanced all of our patients to be part of that.
A couple of years ago, we, I forget when exactly we started, maybe it wasn't 18. We started having a regional meeting. And we are the ones that started it over at Bueller's, over at their community room. And it's really caught on.
It has.
Like tremendously. And now, since that time, we've had it at some of the other institutions, but they keep on. I was just talking to the Lorraine Free Clinic administrator, and he was begging me for us to have it in June here again. And it's neat because we get to share ideas. The key to this program is to realize that you don't know it all. And you need to try to help build your program through different ideas. When I started at Parma, I went to Lorraine and told them I was going to plagiarize everything they had because I was trying to start this clinic there. It's nice.
Well, and in the same way, after we were doing our relationship with Mark's, we got a call from Lorraine saying, hey, would you mind asking if we could do it in Lorraine? No problem at all. Picked up the phone, asked them. They said, sure, let's start. And they've been doing it now for a couple years.
Very nice. So I know we want to save some time for a tour of the facility, but maybe just two more comments. One, how do patients get a hold of you, and what are the hours?
Well, we have a very direct system. We have them call our number. And as you can see, we don't have a receptionist all the time. So what happens is they leave their phone, their name and their phone number, and our clinic coordinator, Vicky, calls them back, gets a complete health history from them, and then also figures out whether they're eligible for our services. And before they know it, they're signed up and they're doing their intake.
One last question. I know we've covered a lot of ground, but is there something that you really want our community to know more about your facility, your clinic?
I think the most important thing about this clinic, beyond the health care that's provided, is the fact that this is a community taking care of its own. And that in itself, I think, is an incredibly rare and beautiful thing.
Mm-hmm.
It's really cool. And that's the second thing, is to realize that it's their next door neighbors that we're taking care of. It's not some person that's bad in their luck. It's just someone that's having a difficult time.
Anything that you'd like to add?
Just that we will continue to shape our care based on what the community needs. So, adding the physicals, being able to do whatever we need to reach more people, that's our whole goal. And we're not going away anytime soon, because the healthcare system is broken. And we want to be part of that system that makes it okay for people to see a doctor.
Well, I certainly applaud your passion and mission for this organization, this facility, your work. I think if there's not anything else you would like to say, we would really enjoy a tour of your facility.
Great.
Sure.